if someone can just volunteer in the interest of the others and then say, sir. Yeah, anyone from the back, please raise your hand. किसी को तीनों पता है तो बताइए. सर बोलो.
C1 is.
नहीं इधर. C ये वाला हाँ.
Zeiss 4 mirror.
अच्छा ये Zeiss बोल रहे हो ठीक है और ठीक है कि नहीं मैं बताता हूँ. आप बोल रहे हो ये Zeiss है और ये.
This is the Posner 4 mirror.
Okay और ये.
This is the golden.
नहीं ध्यान रखो मैंने ऊपर क्या बोला है. All are 4 mirrors. Okay, so anyone can correct him. He got the names right. Suspect. Yeah, but I think he switched between the two. So let's, in the interest of time, let's move on. The names of the spelling you can note first: Zeiss, Posner, and Sussman. This one is actually the Posner. This is the Zeiss. कोई बात नहीं. इतना अच्छा बता दिया तो तीन नाम तो पता है तुमको. और ये Zeiss है. The name of the handle is sometimes asked in your instrument vivas for the residents, and this is known as Unger. Starts with a U. This one. And this one without the handle, still a 4 mirror, is the Sussman. You can see the spellings again. So what Dr. Shushmita told you, my next question on this is, out of so many advantages that you've learned today for 4 mirror gonioscopy, can you name any 2? Again, you want to volunteer? Yes.
You can see.
Mic ले लो बेटा. पहले अपना नाम बता दो बेटा.
My name is Amit
From
Haryana.
Haryana?
Fatehpur.
Fatehpur. Okay.
Yeah, the 4 mirror gives it gives whole view of the angle at the same time and no coupling material is required.
चलो दो बता दिए. Any other?
You can open the angle also by pressing.
So I think yeah, these are the 3 most important, and just to reinforce your memory, you can see these. All quadrants can be viewed at one time. आपको rotate नहीं करना पड़ता gonioscope को. That's advantage for the patient as well as you. Then no jelly or coupling fluid is required. It's less messy. कुछ drip नहीं करता है आपके हाथ पे और patient के घाव गंदे नहीं होंगे. And thirdly, indentation compression gonioscopy and angle closure, which is so rampant in India, is only possible with these. You cannot do it with the golden one. But I have a word of advice, and if you agree, sir, and Shushmita, when you are starting to learn gonioscopy as a resident, please start with a Goldman type. Single mirror, 2 mirror, 3 mirror, वो फर्क नहीं है. But it should be with a Goldman. Is that sound advice? And then once you are more aware of this, then you can switch. Will that be correct? Okay. Now this is the second situation that we have. You have to focus on this. What is the goniofinding? इधर देख लीजिए, it is easier with the pointer. Please look at the screen here. What is the goniofinding here? PAS. Okay, PAS. Anyone else? What do you have to describe, sir? Name is okay, but describe. What do you see actually? Iris processes, I see, hear it from the front. Anything else? I'll give you a case situation to make it easy. This patient has recurrent symptoms of pain and headache. Alright, so the features you can see, the start from the iris are not finger-like. So you can see these are not finger-like exactly. This may be a little less wide, but this is wider. And where are they stopping? अगर ये trabecular meshwork है, तो where are they stopping? कहाँ तक जा रहे हैं? Yeah, up to the TM, up to the trabecular meshwork. They are not going to the cornea or the Schwalbe's line. So what would this be? Why can't they be PAS? Peripheral anterior synechiae क्यों नहीं हो सकते? What is the property?
PAS will go up to the cornea.
Is that correct, sir? Yeah, so that's an important thing that we've revised, what was shown with the videos and the talk, that PAS, if these were PAS, they would go across the TM, is the correct word, they go across the TM, they don't stop short. But with a case situation of pain and headache, this cannot be juvenile or developmental, unlikely. But more terms of angle closure, so yes, these would be goniofinding earlier. This may go into PS later, but right now they are goniofinding. I have a related question on this. So how are they different from PS? We've discussed. And just to give you a visual impression, this would be PS. ये कहाँ तक जा रहे हैं? Absolutely, they're crossing. Let's not say cornea, let's say they are crossing the TM. That's how I learn. That's how I teach. So if they stop short at the TM or they cross the TM, that is how you differentiate between goniosine and PAS. Importantly, they are stopping here. They are not going on to the sclera. So that's an important thing to know. The third situation that I have, again you have to name the goniofindings. Please look here. आप pointer से इधर देख लो फिर उधर देख लेना. You have to name these findings. Anyone? नहीं अब कुछ और लोगों को भी बोलने दो. Anyone? Remember, Dr. Tanuj has a prize for each correct question. Is that correct, sir? कोई भी नहीं. Iris process तो आप ठीक बोल रहे हो ना, but what is the reason? What makes you say this is iris process?
They run parallel to the angle.
नहीं, अब आप दोनों के अलावा इधर से भी तो पूछते हैं. We'll come back to you. Yes, you were saying correctly. The young lady in the third row. Yeah, give them a mic. Mic दे दो. Mic दे दो. Okay, in the interest of time, let's move on. You can see they have finger light. And कहाँ तक जा रहे हैं? Where are they going up to? Yeah, usually up to the TM or just beyond it. Usually at the TM again. पर गोनियोसाइनिक के भी TM तक जा रहे थे और ये भी TM तक जा रहे हैं. Yes.
Contour and the
Contour, yes, they are quite radial. They are not arborescent. They are not confluent into each other. And these are indeed iris processes. And a related question on this, what are these suggestive of? If you see this on a gonioscopy in a 24-year-old girl, 24 साल की लड़की आई, आपको ये मिला गोनियोस्कोपी पे, तो क्या लगता है आपको? What will you think of? This is a case situation. So, again in the interest of time, let's move on. You will think of juvenile and developmental angles. And as you've learned from the previous two speakers, what will be the other features of mesodermal dysgenesis or developmental anomaly or juvenile angles? Anyone can say that? कोई और बोल सकता है iris process के अलावा क्या क्या मिल सकता है और आपको? So I'll go back to the picture and then I'll ask Dr. Shushmita to just reinforce to the audience the features, important ones they should look for. Not theoretic, but what they can actually see. So, Dr. Shushmita, can you go ahead? Other features beyond the iris process?
Usually there would be a concave configuration of iris.
Yeah, you can see here, it's more flat here. यहाँ देख लीजिए फिर से. It's more flat, extending to attach more anteriorly towards the cornea. Not exactly at the cornea, but going more anteriorly. Yes?
And the iris processes could be also seen in normal individuals. So just seeing an iris process does not necessarily mean it's a developmental abnormality. You need to look at other features as well. Usually the iris stroma will be a little atrophic in that because it's not developed so well. And the insertion is a little high if it's a developmental thing, because basically what happens is this iris is not moving back. So those are the parts of the mesodermal remnants which are stuck there, which causes iris processes. The difference between a normal and a developmental or an axonfeld would be, it would be numerous. There would be hundreds of lacy iris processes all over, and the iris would usually be concave as well. That is what would make you look for a posterior embryotoxon. So there are a constellation of findings really. Not just one iris or two iris processes wouldn't make them a developmental problem.
And yes, thank you so much. And then a related thing, how are they different from goniosine? Just to reinforce what you've seen earlier, this is what goniosine would look like. So they are wider, tend to be confluent into each other, and that is how you differentiate. The next thing, you have to look here. PAS, anything else? वही आपको देखना है कहां तक जा रहा है. I think it's crossing the cornea also, crossing the short-base line, going on to the sclera. It's going beyond. It's attaching to the sclera. यहाँ पर कई angle छुपा हुआ है, and they are broad. And so these would be what Dr. Tanuj showed us. Broad-based synechiae of uveitis is one possibility. And how are they different from PAS? Like some of you got it wrong, you were saying PAS to begin with. Let's look at the picture again. क्या difference था previous picture और इसमें? Where does the PA stopping? Definitely not crossing the cornea, not going on to the sclera. So that is how PAS and broad-based INK would be differentiated. Okay, goniofinding here. You have to look here. यहाँ पर देखना है आपको. And just to help out, to help you to answer better, look at this specifically, and then look at the next circle. Look at these two findings especially, and look at the neighboring angle. Anyone? So what we see here is basically in this circle, you can see the pigmentation which is quite grade 3 to 4. It's heavily pigmented alright, but it is not uniform. So it's a patchy pigmentation, but at other places it is heavily pigmented, patchy in this area, and what you can see here are white colored. क्या हो सकते हैं white colored? Yeah, these are exfoliation flakes which were there on the neighboring iris. So iris में flakes, patchy pigmentation, grade 3 to 4 pigmentation, and other areas of the angle. This is so classical of exfoliation glaucoma angle. And how is it different from pigmentary glaucoma? Dr. Tanuj had shown us. अगर pigmentary glaucoma में होगा तब भी यही होगा, तब भी आपको इतना heavy pigment दिखेगा. Yes, it will be uniformly pigmented is pigmentary glaucoma, which is classically seen in a middle-aged myopic male. That is a mnemonic for it. So in a younger patient who is myope and male, pigmentary is more chance. Of course, you will see other features in the iris as well. But this is patchy pigmentation is exfoliation, and I have a related question for you on this. In which part of India is exfoliation glaucoma more likely to be
South
seen?
India.
South India और कोई? आप लोग बहुत उस एरिया से आए हुए हो जो मैं आपको दिखाने वाला हूँ इसका आंसर. एक साउथ इंडिया के अलावा भी है, यहाँ के पड़ोस में है, आगरा के पड़ोस में. सॉरी,
उत्तराखंड में बहुत.
उत्तराखंड. सर बहुत बढ़िया बोला आपने, पड़ोस ही हुआ ना सर यहाँ से. और कोई एरिया? कश्मीर. और कोई एरिया? So I think I'll give you the answer, and then I'll request Dr. Tanuj to just briefly in 2 lines tell us about exfoliation glaucoma as a whole, because that is sometimes so common in these particular parts of India. And Dr. Shushmita tends to see it a lot, being practicing in Chandigarh. She gets a lot of patients from neighboring hilly states. But I request Dr. Tanuj just 2 lines about exfoliation.
I think we have run out of time.
Okay, run out of time, so we'll move on. Okay.
So you can just let the last.
Anyways, these are the last 2. So ये तो आसान है. New vessels is the angle. So ये आपने new vessel क्यों बोला? मैं कहता हूँ ये normal iris के vessels हैं. Yeah, you can see that they are arborescent. Sometimes they are radial at places. Other places they are also growing horizontally. And scleral spur पे. Sir, क्या बताया था आपने scleral spur वाला?
Crossing the skin.
Yes, they are crossing the scleral spur. तो ये new vessels. और मेरा एक related question है इस पे, case situation भी हमने discuss करना था. In which, what is, if you see this picture, what is the stage of neovascular glaucoma? ये कौन सा स्टेज हुआ NVG का? जो 4 stages हम पढ़ते हैं उसका कौन सा हुआ ये? Remember the angle is still open. पीछे angle structures दिख रहे हैं. So this would be stage 3 of NVG, and the first treatment in this patient?
PRP.
Yes, treat the retina, which will be PRP as along with anti-VEGF injections, and only then jump to doing glaucoma surgery only if required. And the last one, the findings. This is a 12-year-old boy with a Holy injury, balloon. कहाँ बोल रहे हो बेटा? यहाँ से ट्रैक करना चाहिए. That's why the arrow is there. You should start seeing a traumatic angle from where it is normal. तो normal यहाँ पर है. आप इस और इस एरिया के बीच में normal है. तो आप देख लो, एक तो iris पीछे को ढलका हुआ है तो पहली चीज क्या हुई? आयरोडायलिसिस। और फिर से एंगल को देखो, यहाँ पर आइरिस, यहाँ पर ये रहा एंगल, यहाँ पर वाइड हो गया। कैन सी दिस? प्लीज लुक एट द पॉइंटर ऑन दिस साइड। So wider angle, grey colored area which is more visible. Grey color किसका होता है?
Angle recession.
Silvery body. So this is angle recession. So basically there are two findings which are very definite, and as comprehensive ophthalmologists, even if you can diagnose these two findings which are so obvious, you've done your bit in doing gonioscopy. Thank you very much, and I thank Dr. Tanush for including me as